I'd like to tell a story about a man by the name of Peter. And this story is about him losing his voice and his regaining his voice. And I'm saying this literally. I have the great privilege, in a sense, and burden to help support and manage a hospital environment. And it's my job there to be aware of all patients at any one time, on any given day. And I became aware of a patient who had been admitted to the hospital because of complications following the removal of his larynx. And due to a serious disease process. And he had difficulties relating, obviously, to how he might be fed, as he wasn't able to eat normally the way we all do at this point in his recovery. And so his problems center around both his breathing issues and his nutritional issues. And I was aware of him for a day before I actually was asked to intervene and assist in planning to help him be able to transition back home. And I was sitting in my office one floor down and looking at his materials and strategizing some of what he might need. And normally what I would do first engagement is I would go visit Peter and assess him myself personally and visually, and take in him as a person and what his needs might be, and then take it from there. However, sitting in my office, I heard a voice, and the voice said, "Call him." And I for a moment thought, what in the world, I can't call him. And I heard, "Call him." And again, I said, I can't call him. I shouldn't call him. Why put the man in that position to answer the phone and not be able to speak to me? That's, not a very constructive thing to ask of him at this point. Now, mind you, he has no vocal capacity, and he has an appliance in his throat through which he must breathe. And there's a lot of, bodily secretions and things of this sort that are generated just in the act of attempting to move air through this area for him. And I know all these things. I've actually walked past his room and heard these things, and I knew what I was hearing in my rounds, when I would make rounds. I kept hearing this voice saying, "Call him." So I picked up the phone and I called his room directly. He answered. And of course, I could just hear almost just wind on the phone. And I said, "Peter?" And I heard something in response. And I said, "My name is Patricia, and I'm going to be stopping by to see you a little later. And I need to ask you a question or two." And then I heard something, and then I actually heard him. I actually could understand him. And we exchanged a comment or two between us, and I promised I would come to see him, and I just wanted him to know that I was coming ahead of time. And then I hung up the phone. Now, along the way, I learned that one of the complications in his situation was his wife, who was described to me to be not very supportive of him at home. She's a very efficient lady. She didn't like the mess that all of his medical supplies created. She didn't like the mess that he was. She had a difficult time being with him and being with his needs, and often would discourage or decline help coming into the home that he might need. And so I was hearing this, and I was aware that the wife was in the room. And I was anticipating that this could be a complication in my ability to actually connect with Peter. When I walked into the room, I greeted Peter, and he sat up in bed, and he was pretty dysregulated and nervous and agitated. And I understand this nervousness and agitation because anyone who's dealing with a breathing appliance like he had, this can make one very anxious. If this appliance were to become occluded or plugged in any way, it generates a lot of anxiety. So he was very anxious. His wife was moving him around the room, wanting to just facilitate his being discharged so she could get home to her life. And this nurse, his nurse, was in the room trying to do what she could to make the wife feel like the process was moving along. I walked in the room and I greeted Peter, and I said, "Peter, my name is Patricia. I'm the person who called you." And he sat up and he looked at me and he said, "You called me." And then something began to happen. And I said, I don't think I said it, because it said, it almost like I could hear a voice. And it said, "I called you." And he sat up again and he said, "You called me." And the voice said again, "I called you." And he said, I could hear him, and he could hear him speaking, and his wife could hear him speaking, and the nurse could hear him. And he said, "I can hear my voice. I have a voice. I shouldn't have a voice now, right now." And it was a moment, and his wife turned, and the nurse stood up from packing his belongings, and there was just this moment. And he began to dysregulate and get nervous again, and his wife chastised him. And he was saying, "I don't know what to do about this problem. I have all this drainage. I don't have the right dressing supplies. I don't know what to do." And this voice that seemed to just come through, just said, "Peter, I love you." And it's as if some kind of a soft force struck him, and he went back into the bed for a moment and relaxed. He stopped jittering. He was breathing in a relaxed manner, and it's like the thing he needed. And the nurse stood up and looked, and the wife walked over and stood next to me. It was this moment. And I said, "Peter," or I said, "This is going to work. I love you." And the whole space changed in the room. And his wife, who's standing right to my right, said, "Well, what do you think he needs?" And so we discussed some things that really might make a difference for him and how they might acquire what he needed. And the whole space changed. And I said, "This is going to work. This is going to work." And she and he started communicating. The nurse began to smile. He was really calmed down. And it was pretty remarkable. What I'm describing is not something that typically within the realm of my profession would occur in the way that it did. And I reached my hand out to him, and for a moment, we just held hands. And he was so calm. And then the last thing he said was, "You called me. You called me." And I said, "I did call you." And he said, "Thank you." I laughed. And afterwards, the nurse and I encountered each other a couple times, and her demeanor, she was like, she knew enough to know something had happened in that room. But to see that man go back in the bed, that was the most, like, he went back in that bed and his head went up to the ceiling and he sat there like he hadn't been told in too long that he was worthy of some aspect of being loved. Like he just took it in. His need was so great. It was like the desert, like he had been through so much, and who could love him enough to help him, replenish what had been expended and lost through his illness. You know what I mean? And it was just it was an expression of love, and it was received as such, and it was just taken in, and I was pretty shaken by it myself. And to hear that man actually speaking when he really was not in a position with. Ultimately, maybe he could make sounds and be heard, but he had a writing tablet in his room. That's how he communicated. It was on a tablet, an erasable tablet. His wife was, here, take the tablet. You need to say something to her, right. And he was like, I don't need the tablet. Can you hear me? Can you hear me? Can you hear me? Like that, he just kept going like that. So this great love, I don't profess to really understand it. It's a great force. It's a great force of that which is calling to be known, being known. That which is calling to be met, being met. And I get really excited at the thought of men and women of the new message being able to respond or somehow serve in some manner, that these things can take place. So this is a story of a man who's finding his voice, reclaiming his voice again.